Hi, and welcome to the Tufts Medicare Understanding Your Medicare Options presentation. As a lifelong resident of Shrewsbury, I am pleased and happy to bring this presentation to you. My name is Tina Ladry, and I can be reached at 508-792-7112. My email address is also listed on the screen, tina.ladry@point32health.org. So what are we going to talk about today? What will you learn? We're going to learn when do you need Medicare, how you can enroll in Medicare, what does Medicare cover, and what other options are available in addition to Medicare. So let's talk about your 65th birthday. So your initial election period comes once in your life. It's when you turn 65. If you are turning 65 and you have no other insurance and you need Medicare, because either you're retiring or you're self-employed or you work for a small group, when you turn 65, you have the choice 3 months before your birthday month to enroll in Medicare A and B. You also have your 65th birthday month, and then you have 3 months after. So we call that the 7-month window. So 3 months before you turn 65, the month you turn 65, and 3 months after. It is always effective on the first of the month. So if you do contact Social Security 3 months before your birthday, your plan will become effective the first of your birthday month. Now remember, not everybody has to enroll in Medicare when they turn 65. This is if you do not have other insurance or you have a special circumstance, but you always want to call Social Security and give them your particular situation. Will you automatically be enrolled in Medicare? No, you're only enrolled in Medicare if you happen to enroll in Social Security at an earlier age. So if you enrolled in Social Security to get your benefits at age 62 or 63 or 64, when you turn 65, you will receive your Medicare card in the mail, and it will have both A and B on that card. Now, if you want Medicare, you certainly can keep that Medicare card. But let's say you're working and you don't need Part B, then you can send that Medicare card back. They will reissue you a Medicare card with just Part A. But if you collect Social Security, you have to accept Part A. They go hand in hand. If you're not collecting Social Security and you do want Medicare Part A and B, you must proactively call Social Security or go online to ssa.org and create an account for yourself. On your online account, you can press the Enroll in Medicare Part B button, and you will start the process to enroll in Medicare. So again, you can call Social Security, you can go to your local Social Security office, or you can go online. Other ways or time periods that you can enroll in Medicare would be called special election periods. This is your step. Anybody who is continuing to work past the age of 65 and has group insurance, remember group insurance is the key word, you can delay Medicare as long as you want, even if you're covered by a spouse through their group insurance. If you're not collecting Social Security, you're leaving your employment, you still can enroll in Medicare as long as you haven't been uninsured for 8 months or more. So in other words, Medicare gives you an 8-month grace period. So let's say you're working and you're 69 years old and you decide, I'm done, I'm ready to leave my job. You have 3 months before you want to make that decision to contact Social Security, enroll in your Medicare A and B, let your employer know you're going to be issued a form. As you can see on the screen, the form is called CMS L564. You are going to need that form to be filled out by your employer. You're going to need your 40B form, which is your application. And those two forms you're going to send in to your Social Security office, or you're going to upload online or go in person. Now these days, we don't know if all the Social Security offices are open or if they have reduced hours. So my advice is always to call your local Social Security office. Try to make an appointment so that you can go in with your forms and hand them to somebody. Try to get a name so that you can follow up with your application. They also have a fax number. Now, if you fax it, you don't know who or where it's going to. But if you talk to somebody, they may give you a fax number in their own office so that you can circle back to them within a few weeks. You want to make sure that you're following your application because it's very important that you get your Medicare A and B before you lose your group insurance. So that would be your special election period. Another period where you can enroll in Medicare would be the general election period. If you missed your initial election period when you turned 65, and then you missed your special election period when you lost your group insurance, you always have the general election period every January 1st through March 31st. The problem is, if you wait till the general election period, Medicare is going to make you wait until July 1st to actually activate your Medicare A and B. So there is a waiting period if you wait until the general election period. So you want to either sign up when you first turn 65 because you have no other insurance, or because you lost your group insurance. So let's talk a little bit about Original Medicare. So Original Medicare was introduced in the 60s. It seemed like a great idea, and it absolutely was at the time. Original Medicare consisted of two parts, Hospital Part A and Medical Part B. Hospital Part A has no premium for most people, as long as you have your 40 credits, which means you've worked about 10 years in the system and you've paid taxes. That's going to give you your 40 credits, which makes you eligible for Medicare and also your Social Security benefit. However, there is a deductible for your hospital insurance Part A, and in 2022, that deductible is $1,556. You also are entitled to your Medicare Part B. Part B is all your outpatient services. 2022, the premium went up. It was probably the highest jump that I've seen in my 10 years working in the Medicare program. It's the highest premium I've ever seen at $170.10 per month per person. There's also a very small deductible for Medicare Part B, and that is $233. So what do you get when you have Original Medicare? Well, you can see any provider in the country that accepts Medicare. You do not need referrals. However, there's no annual out-of-pocket maximum. There's no foreign coverage with just Medicare, and there's no Part D coverage. Your Part B services, so all of your outpatient services, are covered at 80%, and you're responsible for 20% of your charges. So, as you can see, with no annual out-of-pocket maximum, if you're paying 20% of your charges, you don't know what that could end up being at the end of the year. So, God forbid you have chemotherapy at $60,000 for an infusion, you'd have to pay 20% of that, and there is no maximum. So it's very risky just to have Medicare A and B. Maybe in the 60s it was a different story, but now with this incredibly sophisticated medical system that we have, it also comes with a price. That's why people purchase additional private insurance, and that's where Tufts or Blue Cross come into the program, where we can help you with your out-of-pocket costs. But this is how Original Medicare is set up. What are your options with Original Medicare? Well, on the left hand of your screen, you can see you have your A and B. You can add a standalone prescription Part D plan. You can walk around just with your Medicare, Original Medicare, and then a separate prescription drug plan called Part D, and that might work for you. I don't come across many people that do it that way. Usually somebody has something in addition, which would bring us to the middle column, which would be your Medicare plus a Medicare Supplement. We also hear Medigap. So the term Medigap and supplement mean the same thing. So you can purchase a separate supplement plan, And in addition to that, you can add a standalone prescription drug plan. So under this scenario in the middle column, you would have 3 cards in your wallet. You would have Medicare, you would have your supplement, and you would have your Part D plan. So when you go to get an MRI, you would show your Medicare card and your supplement card. When you go to the pharmacy, you would pull out your Part D card. So it's 3 cards. Your other option is the third column, which is Medicare Advantage. When you have Medicare Advantage, it combines your A benefits, your B benefits, and your drug benefits to be complete. That's why it's called C. Medicare Advantage Part C is the complete package, and it is administered through private insurance companies. So under the third scenario, Medicare doesn't get any of your claims. Everything, all of your service all of the bills go directly to your private carrier, and we handle all of your claims. We offer your hospital coverage, your doctor coverage, and your prescription coverage, Part D. So those are the 3 ways to go about entering the Medicare system. 1 card, 1 bill, 1 plan under Prescription Advantage. Part D. Now, this is something that if you're just learning about Medicare, you want to review this quite a few times. It's complicated, it always has been. Once you start the process of shopping for a Part D plan, whether it's embedded in your Medicare Advantage or you're purchasing it alone, you want to talk to the carrier. Give them a listing of your medications, and they are going to tell you what your co-pays are going to be, and they're going to explain the different stages of Part D. I'm going to go over it quickly with you, but stage 1 of Part D is your deductible. So any brand name medications you have, you walk into your pharmacy, you're first going to have to fulfill the deductible. So it's probably going to be $200, maybe $250, $270, but remember that's only for brand name medications. In stage 2, you will pay co-payments. So after you fulfill your deductible, you go in the following month, you're just going to pay your $4, let's say for a generic, or $47 for a brand name Tier 3. That's your co-pay stage. 85% of Medicare beneficiaries will stay in the co-pay stage. However, 15% of Medicare beneficiaries will jump into stage 3, which is the coverage gap. If you remember, a few years ago, it was referred to as the donut hole. The reason it was referred to as a donut hole was because at this stage, you had 0 coverage through Medicare for your prescriptions. Now let's look at the screen where you see the $4,430. This is your Medicare benefit for your prescriptions for the whole year. So when you go to the pharmacy in January and you're picking up 3 or 4 prescriptions, it is being billed against that $4,430. You are going to receive, or you're going to pay your co-payment, so your $47 or your $10, but the true cost of that medication, which could be $100, $112, that is going to be billed to Medicare. It's going to be billed to that $4,430. You want to make sure that lasts all 12 months. What happens if it's October and you go into the pharmacy and the prescriptions that you were paying $47 for are now $300? What happened? Your pharmacist is going to tell you, Mr. Smith, you've jumped into the coverage gap. I'm sorry to tell you, but now you have to pay 25% of the Medicare approved price for those prescriptions. So you go from a copay situation to a cost share co-insurance situation, 25% the cost. Again, years ago, there was 0 coverage, and through different administrations in Washington, in Congress, and the President, they were able to close that donut hole to get it to 25%. So thank goodness it is finally down to 25%, your cost share in the coverage gap. Now, Medicare is also keeping track of all your copays, and they're keeping track of the cost of your medications in the coverage gap. And when that number reaches $7,050, now that's not you paying the entire $7,050. It is your copays in the initial coverage period being added up. It is the 25% that you're paying in the coverage gap. And it is another, 75% of the prescriptions in the coverage gap that you are not paying, you're still getting credit for. I'm sorry, it's 70%. So you're getting credit for 95% of the prescriptions in the coverage gap, even though you're only paying 25%. So let me repeat that. You go in, the prescription is $1,000. You're going to have to pay $250, but you are going to get credit for $950 to go towards that $7,050. I know it sounds complicated, but all of these payments are being lumped together to get you out of the coverage gap and into the catastrophic coverage, fourth stage. And at that point, for the remainder of the year, you would pay $3.95 for your generic, or $9.85 for your brand. And this is your final stage of Part D. And then once January comes, it starts all over. Let's talk briefly about what a supplement is. So a Medigap plan is simply a payer to Medicare. So Medicare gets your bills first. They pay their 80%. They send the remainder to to your private insurance company, and that insurance carrier will pay the remainder depending on which supplement you choose. Medicare remains your primary insurance. Your supplement is accepted anywhere Medicare is accepted. However, it does not include Part D, so you would have to purchase that separately. And in Massachusetts, you can enroll anytime into a supplement plan. So if you happen to be with one carrier and you want to switch to a different carrier, you can do that anytime. It doesn't have to coincide with the annual open enrollment, which is in October. Supplements are overseen by the Division of Insurance in Massachusetts, and Massachusetts says you can change your supplement anytime. Let's talk about Part C, the complete Medicare Advantage plans. So as long as you have your A and B, you're ready to enroll, and if you're ready to enroll in a Medicare Advantage plan, it will become effective the same month your Medicare Part B becomes effective. So you're retiring, you're losing group insurance at the end of August, your Medicare is going to begin September 1st, your Medicare Advantage plan will begin September 1st as well. Advantage plans can be HMOs, they can be PPOs, they can be special needs plans, or they can be what's called a SCO, senior care option. All of your Medicare benefits will include A and B, hospital and medical, but they are allowed to add additional benefits. So for instance, an annual physical, a routine eye exam, a routine hearing exam, an eyeglass benefit. Those are all extras that are added by private insurance companies under Medicare Advantage. So again, you have the same 7-month window to enroll into an Advantage plan that you had with Medicare A and B. So you want to get your A and B going first, get that application started. I always tell people that's the first thing on your list. Contact Social Security or get that application in. That's the most important thing. In the meantime, figure out which plan in addition to Medicare, you want. You have 3 months before you submit that application to do all the paperwork, and that can begin on the first of your birthday month, or you have 3 months after to enroll in that Medicare Advantage. If you're over 65, you have the 3 months before your Part B effective date to enroll in your Medicare Advantage plan. So again, in the scenario where you're retiring at the end of August, you're going to lose your insurance, you can enroll in Part B for September 1st, and you get your Medicare Advantage for September 1st as well. So other times you can enroll in a Medicare Advantage plan would be the annual election period. Very important period when you're on a Medicare plan, because this is what I call the shopping period. Between October 15th and December 7th every year, you know that all the carriers are going to send you mail. You're going to see all the ads on TV. Everybody wants your business. This is when you can see what's new to the market, what's changed, have the premiums changed, and you can switch your Medicare Advantage plan. Now remember, this is a very small period. You have to get that change or that application by December 7th. There's also an additional time after January 1st where you could go from an Advantage plan to another Advantage plan, and that is called the open enrollment period. But for your annual election period is when you can go from original Medicare and pick up a Medicare Advantage plan. There are other ways that you can enroll in an Advantage plan, and that would be special election. So you're moving. You live in Shrewsbury, you're done with the winters, you're going to move to Florida. When you move, you're entitled to pick a new Medicare Advantage plan in your new area. If you become eligible for federal assistance such as Medicaid Extra Help or Medicaid, if you lose eligibility or gain eligibility into those programs, you are allowed to change your Medicare Advantage plan. If you qualify for the Massachusetts state program called Prescription Advantage, you are eligible to change your Advantage plan. And finally, when you're enrolling into a 5-star plan, which Tufts Health Plan is a 5-star plan, you can enroll into our plan anytime. So if you're not happy with your current Medicare Advantage plan, you can find a 5-star plan in your area and you can make a change. I'd like you to see the resources on the screen because it's always nice to get your facts straight from the source. Be careful of when you're surfing around online and then you might get yourself lost into websites or email it or web addresses that are sending you down the wrong road. So I always say go directly to the source. Medicare.gov is a fantastic website. They have done wonderful things. There's a plan finder. You type in your zip code. It'll pull up all the plans in your area that are available to you. It'll do comparisons for you. You can print out a chart. You can call Medicare. You can also go to socialsecurity.gov to learn more about your Social Security eligibility. You can also create your account at socialsecurity.gov. I have mine. Everybody should go to ssa.gov or socialsecurity.gov and just sign in. You're going to get a password and a username, and you'll be able to check your work history. You'll be able to do some estimates and calculations. Okay, what if I retire this year and my spouse still works? What does that scenario look like? All of that can be tailored to you once you create your online account. In Massachusetts, we have the Shine counselors. We have them here at the Shrewsbury Senior Center. Very, very important resource for anybody in Shrewsbury or in the state of Massachusetts looking for assistance. You can make an appointment with your Shine counselor, and they will help you go through all the noise of the health insurance options that you have. They have our materials from the private insurance companies. We meet with them in October, so we talk about our plans, so they're familiar with our plans. And basically what they do is they walk you through the plan finder on Medicare.gov to help you get the information you need. Ultimately, it's your decision. Prescription Advantage is for anybody who thinks they're going to go into the coverage gap with their prescriptions. We are very lucky to have this program in Massachusetts. You want to either go online and download an application or call them. It is income-based eligibility, but I advise anybody who thinks they're going to go into the coverage gap to at least try and apply for this program and see if you get approved. It helps tremendously when you go into the coverage gap. And then, of course, if you think you would qualify for a senior care option or any state or federal programs, you can go to mass.gov, Mass Health. So that concludes our brief presentation on Medicare. I want to thank you for joining me. My name again is Tina Ladry, lifelong resident of Shrewsbury. Very happy and privileged to bring you this information. Please feel free to call me or to email me at tina.ladry@point32health.org. I'm happy to meet with you in your home, or we could meet right here at the Shrewsbury Senior Center. I'm always available for questions and additional information. Thank you and have a great day.